Welcome, everybody. I'm Wes Warren here with Greg Stanley. Case presentation and different scripts that you should incorporate, or certainly versions of it. Everybody will do something a little different. Really make sure you understand the importance of this. Roy Smith was at one of our meetings, and he said that his scripts were so canned and so rehearsed, and everything was the cadence was the same every time, that it was so rehearsed that his assistants would have to turn the vacuums on or turn the water on when he was delivering a script, because they were afraid the person next to him who had just heard the script would hear it if they didn't do it. That's how canned his were. And yours has to get that way too. You have to kind of find your own scripting that works for you. We'll help you with some of that here today, but you have to rehearse it and really get it down.
You have to listen to a new associate, maybe his first time or her first time in practice. They wander all over the place.
Different every time. You know, there's no consistency. It's just, it's crazy.
Well, we know a couple of things that have to happen. Number one, we have to achieve trust, clarity. What's wrong? What caused it? What we have to, how we fix it? Is there any alternatives? We have to cover certain things, and giving people kind of a lesson from dental school doesn't usually work out, where we tell them all kind of stuff.
I've seen all kinds of different case presentations, and some good, some bad. But yeah, there are certain things you've got to accomplish, and most people don't want to become a dentist and learn the ins and outs of
The microbiology.
Yeah, but there is a percent, and you'll certainly impress those the 10% or the 5% that are. But there are key points that you've got to accomplish in the case presentation. And I want to talk about one of those points and a strategy, or not strategy, really scripting.
Right.
We talk about this, that during your presentation, talking about everything you're finding and possible recommendations. I've seen doctors kind of wander all over the place here and talk about different options, and everything kind of can be confusing, especially non-assertive doctors. They'll tend to definitely not be confident in their tone. And so here at Whitehall, we train our doctors to, at the very end, direct the patient what you want them to do, by simply saying, look, if I were you, this is what I would do in your situation. Or you could say something like, if you were my mother, if you were my son, this is what I would tell you to do. And that's very important, that that line is delivered with some confidence in the tone of voice. And then you talk about what you'd have. You know, if I were you, this is what I would do. And the key point is, and here's why. At this point, you don't need to recover what a crown is, and talk about the importance of cover and how great that crown is. That should have already been talked about. So this is the Cliff Notes version of what I'm going to recommend to you. I would get that crown done, and here's why. We're risking a root canal. We're risking an implant. We're risking losing the tooth. We're risking a bridge. Whatever the next phase of dentistry is going to be, the consequences of not being treated really needs to be talked about at this point. And then it wraps it all up. There is no options here. You've told the patient exactly what you would do in their situation. Then there's the handoff. How do you get from there to the front desk?
Right.
Everybody does this different, but it could be as simple as saying to the patient, and we'll get Susie from the front desk, the treatment coordinator, and she'll discuss with you exactly how much it's going to be, and if you've got insurance, how much insurance will cover. And then she can get you scheduled for this. Are there any other questions for me? That's a canned speech, and that should be delivered every time.
That's a great handoff. Actually, some doctors don't know how to get out of a room.
Yeah, and that little sentence literally
ties it off.
Right. So I would say about a third of our doctors struggle knowing how to hand it to who, you know.
The more non-assertive and friendly and kind you are, the harder it is to get out of the room.
So, you know, Susie at the front desk, she'll tell you exactly how much this is going to be and how much your insurance will cover if you've got insurance. And she can get you scheduled. Now, don't forget that part. And then she can get you scheduled for this. It was nice meeting you. Are there any other questions for me?
And by the way, if a patient asks you a question, welcome it. It builds trust.
Yeah.
It builds relationship. So don't be, sometimes we try to communicate, don't ask me any questions, even though I just said, do you have any questions?
The other thing that you got to learn is how to create a case presentation that is budget sized. Meaning they've got $6,000 worth of dentistry they should do.
Right.
And you've told them, that you saw all these problems. But how do you tell them, let's get started here? Let's get, every doctor is a little different. I've heard all kinds of different ways to do, but this is hugely important. Because if you leave the room saying $6,000 and it's a new patient, you're going to really struggle in your case acceptance. So vast majority of people, that's way outside their budget, and they'll go home and tell their husband, and he'll think that you're crazy and never go back there again. Especially if it's unexpected treatment. If it's expected treatment, you can deliver it and say, we'll just try to work it into your budget and get as much done as possible. If it's unexpected treatment and you get outside of the budget zones of your area, which range what people can afford in their budget, knowing how to verbally get out of that without being unethical. I've heard one of our doctors will say, some people are on a 1-year plan, some people are on a 3-year plan, some people are on a 5-year plan. That's okay with me. And if I were you, I'd get started right here. And then he goes into it. Just like I said, if I were you, this is how I would, this is the truth I would do. I'd start right here. So there are different ways of how to, so you don't have to cram the whole amount. You're essentially wrapping up the whole treatment plan and jamming it down their throat. You'll get a lot of goose eggs that way, especially with marketing patients. So it's learning how to get out of having to present the whole thing and kind of expect them to do it all. And ethically, you feel like you have to do this, but it's not going to fit in anybody's budget. And it's just not going to work.
I've seen a prosthodontist show big cases because they kind of think of themselves as being there to do a big case. And I've seen them go 10 for 10. 10 patients, no sales.
Yeah.
And because they're outside that budget zone you're talking about, a lot of people, and I'm included in this group, I once thought that if you showed people too much, they'd just buy less. Actually, if you show them too much, they don't even feel comfortable in your office anymore.
Right. You get zeros. The best way you could tell if you're struggling with this is to look at your closing percentage. Look at the percentage of patients that are new to the practice that buy something that's restorative that you diagnosed. Most people are about 30 to 50%, which is not good, by the way.
Not if you're buying those patients.
Yeah, you need to be at 70 to 80% is considered good on new patients. Some, unfortunately, are 10, 20%, like a scary low amount.
Well, it's like you were saying, though, that's where I've seen that before. When I see incredibly small case acceptance, you can usually trace it to an incredibly large case presentation.
What's funny is this, I've done a few studies on these practices. They thought they were doing pretty good. I said, let's do a study on your case acceptance. We'll track it over a month and see what percentage of the new patients move forward. And they go, doctor's pretty good at this. Doctor's pretty good at this. And we did it, and it was 22%, and he was horrified.
Yeah.
So it can be deceiving. Just because you think you're doing good doesn't necessarily mean you are.
It's like when the patient says, I'll call you back. It doesn't mean they will.
So the good news is you can work on your scripting, work on these key points like we're talking about, the transition, how to not bundle it up so you're delivering large treatment plans ethically, how to deliver that, how to create urgency. These things you can work on, and you can see if your numbers change. Your numbers should change next month. So you should go, if you're at 40% and you incorporate some of the things we're talking about and really talk with confidence at the end, you can go to 80 and you go, there, it worked.
Right. And
then you lock it in. You really memorize the scripts that you're using, and you're in a good place with your practice and your end of the case presentation. So
then just make sure associates are doing the same thing.
I mean, we've had a lot of different scripts that we've talked about in Whitehall. especially for case presentation, one of the more famous one is the My Job, Your Job. My job is to show you the finest dentistry that there is that you can find around, and your job is to decide how much and how fast you'd like to proceed. There's different scripts, but you've got to learn these and test them and track and see if there's a change in your acceptance rate.
There'll be staff hearing this, going to get their doctor and have them want to watch it because they don't know how to get out of a room.
One, you gotta learn how to get out of the room. So just say, Susie will work with you at the front desk. She can tell you exactly how much it's going to be and exactly how much insurance can cover, and she can also get you scheduled for this.
That's how you get out of the room.
That's how
Any
you get.
questions for me?
Is there any questions for me? Well, it's really nice meeting you. Thanks for coming in. That's how you get out of the room.
Always ask for questions like it's okay to ask.
Yeah, right. Because sometimes they have a question. Why do I need to do? Are you
Remember-
sure I need to do this now?
Or all of this.
Or is there other options?
Those are great questions, buying questions.
Right. So, yeah, use some scripts if you're struggling with scripts or certain parts of the case presentation. Like I had a doctor this weekend that was struggling with people just opting for the extraction as opposed to restoring the tooth, and didn't really know how to talk about it without and so we developed a script for it. And he was like, "This is really good, thank you."
Yeah.
And you can work on your argument. So you go, "Hey, we'd be happy to extract the tooth, but I just want to warn you that it ends up being a domino effect. And once you do one, it tends to lead to more. So I don't suggest it, and if you really want to keep all your teeth."
Yeah, you can't just take a patient on and go, "No, this is what you need. I don't want that." You need this.
Right.
Because they'll
Be
just
glad
come
to
up
do
with
that. I just
another,
want to warn you that this is what
Yeah.
tend to see.
Right.
So we developed this. There's a script. You memorize it, and you see if it changes the outcome. And so each area in your case presentation where you feel like you're getting pushback, you need to work on it, and then measure the results and see if it got better. Right. All right. Thanks for listening.